This lecture is titled Oral Pathology and corresponds with the course DA 140A Integrated Basic Science. After watching this lecture, you should be able to explain why oral pathology is important for the dental assistant, explain why categories of diagnostic information are necessary, describe the warning symptoms of oral cancer, describe the types of oral lesions, name 5 lesions that are associated with HIV or AIDS, describe the appearance of lesions associated with the use of smokeless tobacco, describe 3 conditions associated with the tongue, identify 2 oral conditions related to nutritional factors, recognize developmental disorders of the dentition, list and define 3 anomalies that affect the number of teeth, list and define 5 anomalies related to the shape of the teeth, define, describe, and identify developmental anomalies, describe the oral conditions of a patient with bulimia, describe the classic signs of inflammation, differentiate between chronic and acute inflammation, and identify the oral effects of methamphetamine use. Oral pathology is the study of diseases in the oral cavity. Only a dentist or a physician can diagnose pathologic conditions. It is important for other dental professionals, such as the dental assistant and dental hygienist, to be able to distinguish between normal and abnormal conditions in the mouth. Review Chapter 10 in your book for normal oral structures. Let's begin by discussing how things are diagnosed. There are different methods that may be used to make a diagnosis. You may use one of these methods, or you may use multiple. A historical diagnosis is based on personal, family, medical, or dental histories. A clinical diagnosis is based on the appearance, such as size, shape, color, and location. A radiographic diagnosis means that you look at X-rays to view apical or bone lesions. A microscopic diagnosis means that tissue is removed, which is called a biopsy, and it is sent to the lab to be evaluated. A laboratory diagnosis is done using blood chemistries, urinalysis, or other tests for the patient. A therapeutic diagnosis is done by providing treatment and evaluating how the lesion responds to the treatment. And a surgical diagnosis means that you are surgically opening up an area of the body for inspection. A differential diagnosis is when 2 or more possible causes of a condition are identified, and more than one test or procedure can be used to make the final diagnosis. Inflammation is the body's protective response to injury or irritation. Inflammation can manifest in 2 ways: acute inflammation and chronic inflammation. Acute inflammation means that it comes on quick and is short-lasting, where the tissue begins to repair quickly. Chronic inflammation is when the injury or irritation continues for a longer period of time. Typical signs of inflammation are redness, swelling, heat, and pain. We will now dive into looking at different types of oral lesions. A lesion is a term used to describe abnormal tissues in the oral cavity. It may be a wound, a sore, or tissue damage from an injury or illness. It may extend below or above the mucosal surface, or they may lie flat and even with the mucosal surface. We'll first discuss lesions that extend below the mucosal surface. First is an ulcer. An ulcer is a break in the mucosa and appears punched out or crater-like. Erosion is a shallow injury caused by mechanical trauma such as chewing. The margins may be red, jagged, and painful. An abscess is a collection of pus in a specific area. They are commonly found at the apex of a tooth. A cyst is a fluid or semi-solid fluid-filled sac. It is not always infectious inside and can be filled with some other bodily material. Now let's look at some of the lesions that extend above the mucosal surface. A vesicle is a blister that is filled with a watery fluid and ruptures easily, leaving behind an ulcer. A pustule looks like a blister, but it contains pus, which is typically a whitish yellow color. A hematoma is similar to a blister but contains blood. A plaque is a patch or flat area that is slightly raised from the surface. An ecchymosis is a bruised type lesion. Now we will look at lesions that can be raised or flat. A nodule is a small, round solid and may appear below the surface or slightly elevated. When palpated, which means when you squeeze it between your fingers, it can feel like a pea between the surface of the lip. A granuloma is a nodule that contains granulation tissue. Tumors or neoplasms are a mass of tissue that grows beyond its normal size. They can be benign, which means they are non-life-threatening, or malignant, which means they are life-threatening. Pictured here is a picture of a pigmented exothopic growth malignant tumor. Leukoplakia is a term that means a white patch. It is firmly attached to underlying tissue. Rubbing or scraping it will not remove it. The cause of leukoplakia is unknown, but may be linked to chronic irritation, such as from smokeless tobacco, poor-fitting dentures, or cheek biting. Often, a leukoplakia is a precursor to a malignant lesion later on. Lichen planus is a benign and chronic condition. The appearance is patchy white, but the pattern is characteristic with lines and circles that interconnect, and this pattern is known as Wickham's striae. The cause of lichen planus is unknown and is possibly autoimmune related. It can cause erosive lesions on the gingiva and tends to worsen with emotional stress. It may or may not cause discomfort to the patient. Candidiasis is a superficial infection caused by a yeast-like fungus called Candida albicans. It's the result of an antibiotic therapy, can be the result of xerostomia, diabetes, or a weakened immune system. There is pain associated with it, as well as dysgeusia, which means altered taste, and halitosis, which means bad breath. Pseudomembranous candidiasis is also known as thrush. Thrush is creamy patches that form in the mouth, and they kind of resemble cottage cheese in their look. They create a burning sensation and an unpleasant taste for the patient. These plaques can be scraped off. Hyperplastic candidiasis appears as a white plaque that is often found on the buccal mucosa of patients infected with HIV virus. The plaques cannot be removed by scraping. Atrophic candidiasis, which is also known as erythematous candidiasis, appears as smooth red patches. The patient's mouth may feel burned or scalded. Usually this type happens in patients after taking a broad-spectrum antibiotic. Aphthous ulcers are also known as canker sores. There is an ulceration of the oral mucosa, and the duration is 7 to 10 days. Recurrent aphthous ulcer, also known as RAU, is a disease in about 10% of the population, where outbreaks are more frequent and take longer to heal. The need for medication may be necessary for some of these patients. We will now look at some of the conditions of the tongue. Glossitis is a term used to describe inflammation and changes of the tongue. So glossitis is a very umbrella term for other things. Black hairy tongue means that the filiform papilla become long and resemble hairs. They become stained by food and tobacco, which is what gives it its name, black hairy tongue. Possible causes could be from an imbalance in the oral flora due to medications, and possible treatments may include oral hygiene, including tongue scraping, and in some cases, antifungal medication. Geographic tongue involves loss of the filiform papilla in irregular shaped patterns that resemble a map. Changes in the patterns can happen over weeks and months. This occurs in about 1 to 3% of the population. It is considered a normal condition and no treatment is necessary. Pernicious anemia is caused by a lack of absorption of vitamin B12. Signs include anemia, weakness, pallor, and sometimes nausea, diarrhea, abdominal pain, and loss of appetite. Angular cheilitis, which is ulceration and redness of the corners of the mouth, burning tongue, and loss of papilla are also oral manifestations of this disease. We'll now talk a bit about oral cancer. Oral cancer is one of the 10 most occurring cancers in the world. It is frequently fatal and often not painful in the early stages, so it can go undetected easily. One of the most important roles of a dental professional is to perform regular oral cancer screenings on patients. The dentist and hygienist can perform these routinely at each recare visit. Any sore, discoloration, induration, prominent tissue, irritation, hoarseness, complaints of difficulty swallowing, unilateral earaches, which do not resolve within a 2-week period on its own, with or without treatment, should be considered suspect and worthy of further examination or referral. This quote is from the Oral Cancer Foundation. A carcinoma is a malignant neoplasm or growth of epithelium that invades the surrounding bone and connective tissue. It can quickly metastasize or spread to other regions such as the neck and cervical lymph nodes. It can occur on the lips, tongue, cheek, and floor of the mouth, and the appearance is white or ulcerated but can look like a red velvety smooth lesion. Adenocarcinoma is a malignant tumor from the underlying glands of oral mucosa. It appears as a lump or a bulge beneath the overlying normal mucosa. A sarcoma is a malignant neoplasm that comes from supportive and connective tissue such as bone of the jaws. When involving bone, it is called an osteosarcoma. May start in the bone but can spread to surrounding tissues. Leukemia is cancer of blood-forming organs where there is a rapid growth of leukocytes, also known as white blood cells. Oral symptoms include bleeding, ulceration, enlargement, spongy texture of the gingiva. Other symptoms include enlarged lymph nodes, anemia, and general bleeding. Smokeless tobacco is a concern because of the high rate of precancerous leukoplakia found in areas where tobacco is held, irritation of the oral mucosa, and increased incidence of tooth loss from periodontal disease. Radiation mucositis is inflammatory changes in the oral mucosa. Appearance is white and patchy and surrounded by redness. Xerostomia, which we've discussed before, is destruction of the salivary glands, which reduces saliva flow. Lack of saliva causes infection, delayed healing, and difficulty wearing dentures. There are some dental implications from radiation therapy. First, there is radiation caries. The lack of saliva causes a high incidence of caries, especially on the cervical third of the teeth. Osteoradionecrosis means death of bone. We must be careful when extracting teeth because there can be poor healing after these extractions. There are also dental implications of chemotherapy, such as mucositis, aphthous ulcers, transient reactions such as cheilitis, glossitis, and paresthesia, xerostomia, delayed healing, and dentinal malformation. This is when it's administered to children and causes disruption in tooth development. The leading cause of oropharyngeal cancer is from HPV. A very small number of oral cavity cancers also occur from HPV. The HPV family contains almost 200 strains, and it is one of the most common viruses in the United States. It is important to understand that of all of these, only 9 are associated with cancers. Of the 9 that are high risk, only 1 is strongly associated with oropharyngeal cancer, HPV 16. Let's now look at some of the oral manifestations of HIV and AIDS. First, we have HIV gingivitis. This results in bright red line along the border of the free gingival margin. It is also called atypical gingivitis. Redness can progress, or petechiae-like patches can appear over the gingiva. Petechiae are kind of small, very small little red dots over the gingiva. HIV periodontitis is similar to acute necrotizing gingivitis. It progresses very rapidly and results in pain, bleeding, and halitosis. Kaposi's sarcoma is an opportunistic infection of HIV. Oral lesions are blue, blackish, or reddish blotches and flat in appearance. There is no effective treatment available, but sometimes surgery or radiation can decrease the size. Intraoral lesions indicate a history of HIV and often help to diagnose AIDS. The human papillomavirus, or HPV, is responsible for warts such as oral papilloma, common findings in patients with early HIV. Diagnosis is with clinical findings, history, and a biopsy. The appearance is spiky or cauliflower-like, but they may be well defined with a flat surface. Treatment includes laser excision, but they often recur after they are removed. Let's discuss developmental disorders. When cells in the body divide, a developmental disorder can occur, and the result can be a deformity. An inherited disorder is caused by an abnormal gene from parent to child, and it comes to the child through the egg or the sperm. Congenital disorders are present at birth and can be either developmental or inherited. Developmental disorders are influenced by genetic or environmental factors. Genetic factors are often from abnormalities in the chromosomes. Common genetic abnormalities include size of jaw in comparison to size of teeth. Developmental disorders can also be from environmental factors. Teratogens are environmental factors that cause developmental disorders. Examples include infections, certain diseases in the mother can cause birth defects, and drugs. Tetracycline ingested by a pregnant mother can cause a yellow, gray, or brown stain on the primary teeth. Aspirin, cold medications, alcohol, or recreational drugs can also cause disorders. We can have some disturbances in jaw development. Macrognathia is abnormally large jaws. This often involves the mandible, resulting in a class 3 malocclusion. Micrognathia is the opposite. It means that there are abnormally small jaws, and often it is the mandible and results in a class 2 malocclusion. Exostoses are benign bony growths, which are also known as torus, or the plural is tori. They can be on one or both arches. A torus palatinus is on the midline of the palate, and torus mandibularis is on the lingual surface of the mandible. As you can see in the top photo, they can also occur on the buccal surface as well. Ankyloglossia is the medical term for tongue-tied. This means that a patient has a short lingual frenum that extends to the apex of the tongue. An amelioblastoma is a tumor composed of remnants of dental lamina that failed to disintegrate after tooth buds formed. Hutchinson's incisors are a disturbance in tooth development that occurs due to the mother having syphilis. Twinning occurs when tooth bud division is complete, but it results in an extra tooth. It's a mirror image of its partner tooth. Ameliogenesis imperfecta is a defect in the formation of the enamel, such as hypocalcification, which is incomplete hardening of the enamel of a tooth. Dentinogenesis imperfecta affects formation of the dentin and is often an opalescent and almost amber color. Soon the enamel chips away and the teeth end up wearing down. Premature tooth eruption means that baby's teeth are present at birth. These teeth are also known as natal teeth. Ankylosis is when deciduous teeth in which the cementum and the dentin are fused to the bone, which prevents the tooth from being exfoliated. Impaction refers to any tooth that remains unerupted. Most often this happens with the wisdom teeth or third molars. Abrasion is abnormal wearing away of tooth structure. Possible causes are improper toothbrushing or hard toothbrushing, as well as an abrasive dentrifice, which can be a toothpaste. Attrition is normal wearing away of tooth structure during chewing, and it can be made worse by bruxism or grinding. Typically, attrition is greater in men than in women. Bruxism is an oral habit characterized by involuntary gnashing, grinding, or clenching of teeth. It is usually a nocturnal habit and can become more pronounced in periods of stress. It can cause abnormal wear, injure the periodontal ligaments, causing tooth soreness, and contributes to temporomandibular joint disorders, or TMJD. The treatment for bruxism is a night guard or splint therapy. Bulimia is an eating disorder characterized by food binging followed by self-induced vomiting. It results in a pattern of erosion on the lingual surfaces of teeth and is apparent due to the acid coming into contact with the teeth. You should encourage daily fluoride and rinsing of the mouth with water immediately after vomiting, and encourage the patient to seek professional treatment. Orofacial piercings can cause dental complications. They can cause chipped or broken teeth. They can cause infection at the site of the piercing that can spread, and they can cause mucogingival defects. A condition called meth mouth is on the rise in the United States because meth is cheap to make and the high lasts up to 12 hours. It is a central nervous stimulant that causes brain damage and oral health damage. The result is rampant caries on buccal smooth surfaces of teeth and interproximal surfaces of anterior teeth. It can cause drug-related xerostomia, poor oral hygiene, and clenching and grinding, which can all contribute to decay. Let's summarize some of the key points from this lecture. Oral pathology is the study of diseases in the oral cavity. Only a dentist or a physician may diagnose pathologic conditions, but it is important for the dental assistant to be able to recognize the differences between normal and abnormal conditions that appear in the mouth. Many systemic diseases, as well as infectious diseases, have oral manifestations. The dental assistant should understand how oral abnormalities affect the patient's general health and planned dental treatment.